Monique Visser is a clinical ethicist with Health Shared Services, supporting public health, home care, hospice, continuing care facility living, continuing care supportive living, Cross Cancer Institute, and corrections within the Edmonton area. She is a Bachelor of Science in Nursing and practiced as a registered nurse in several communities across Canada and in Saudi Arabia. She worked primarily in high acuity care settings and completed a graduate certificate in critical care. Her academic background also includes a Master of Bioethics from the Harvard Medical School and further ethics training with Alberta Health Services. In May 2025, she completed a Healthcare Ethics Consultant Certified program. She is also on the executive board of the Canadian Bioethics Society. Her research areas of interest include exploring everyday ethics, moral distress, and the role of ethics education as part of preventative ethics. Without further ado, I pass it over to you, Monique. Thank you again for being here.
Thank you so much for having me, and give me a second. I'm going to share my slides. There we go. Are people able to see my presentation?
It looks great, Monique.
Excellent. Okay, so thank you so much for having me. Again, my name is Monique Visser, and I'm a clinical ethicist with Health Shared Services and a clinical lecturer with the John Dossiter Center. And today we're going to be talking about everyday ethics, really kind of a brief introduction, kind of unpacking some of what I've been thinking about in this space. However, it is in early stages, and I really would appreciate any opportunity to engage in questions and dialogue. This is the start of my thinking in this, not the conclusion. So I would really welcome conversation, questions. The chat will be open the entire time. So if you have thoughts along the way, there will also be opportunity to interact as we go along. So I would encourage you to participate in the chat function as well as we go along. Um, Thank you, Michael, for doing a land acknowledgement. I just also want to note that as we talk about everyday ethics, I think it's important to reflect on where we are presenting today, given that there is a lot of in this conversation about individual values and individuals' perspectives as they engage in the healthcare setting, including conversations around power and power dynamics. So I think it is really important that we make that land acknowledgement, and I want to thank you for doing that. Next, afterwards, the very important space of giving ourselves a little bit of time to think about where we are presenting and how we are situated in that space is a little bit of housekeeping, which includes a declaration. So around conflicts of interest, I have no relevant relationships with any commercial entities, nor do I have any potential conflicts of interest within this presentation. So no steps were taken to mitigate this potential bias, but I will acknowledge that ongoing self-reflection is always occurring around my own views on things and potential bias, including in relation to this presentation. Additionally, I have a couple of special thank yous to do. So I'm going to make a special thank you to the Harvard Medical School Center for Bioethics Everyday Ethics Affinity Group, where we meet regularly and we discuss everyday ethics. We look at these questions. We engage in a lot of dialogue back and forth about what everyday ethics might mean in our own practice. How do we talk about it? What literature is out there? And so it's been a very valuable place to kind of explore and unpack some of these ideas. Especially Elaine Myers, who chairs that group, as well as Christina and Shika, who I've been working with on the concept of what an everyday ethics definition might look like. So the aims of this presentation, really, I want to take a distinction between major ethical issues and everyday ethics. Sometimes we refer to this as big E ethics issues or little e ethics issues. Other ways you might be referred to as micro and macro ethics, the ethics of the ordinary and the ethics of the extraordinary. Everyday ethics are dramatic ethics. It often gets referred to in different ways in the literature. So just kind of drawing what makes these two things distinct and establishing a conversation around a working definition, outlining some of the key components of everyday ethics. I may overpromise here a bit there around what a comprehensive definition might look like. I really love your perspectives on what you think everyday ethics might be, whether the things that I've shared accurately capture that or whether you think I'm completely off base. And then briefly examining some of the impacts everyday ethics has on healthcare professionals, recognizing that it has a ongoing impact every day as we define it or unpack it a little bit. So I think it is important to acknowledge where it might be relevant in that practice. So you work in healthcare ethics, or you work in bioethics, you work in the ethics space, you engage in this space. People might ask, "Oh, what kind of stuff do you work on? Can you give me an example?" Why might somebody call an ethicist? Um, Anyone have any thoughts about, how you might go about doing that? You're Sometimes some people might refer to this as an elevator pitch. So for me, definitely the elevator pitch is very much an example of very case-based. Oh, it's an example of questions around withdrawing life-sustaining treatment if the clinical team and family disagree. You might look at questions around genetics, abortion, these often quite contentious issues that can create a lot of questions. People may be familiar with these topics as well. So big E ethics often come from examples that come out of challenges or scandals. They often have a dramatic public profile. So these are the things that we tend to teach in classrooms a lot. So you may be familiar with many of these case examples. These are ones that often get used in the classroom. So Karen Ann Quinlan and with the questions around withdrawing or withholding um, advanced life-sustaining treatments. It is one of the very first cases that is mentioned in the Principles of Biomedical Ethics by Beecham and Childress. It is a case that often gets discussed in the concept of what is bioethics, how do we teach clinicians to think about ethics in their practice. It's also used in a lot of policy conversations around things like defining what is brain death and its impact on clinical practice. So its implications for things like organ donation and organ transplantation. What does it mean to engage in questions around scarce resources? It also can impact things like legislation, where we talk about things like medical assistance in dying and discussions of expansion and restrictions for access to MAID, as well as the role for individual clinicians around conscientious objection and what obligations might come along with that. So these questions tend to be quite high level as far as you're looking kind of from the outside in. However, and we often explore big E ethics issues using clinical evidence, standards of care, policy and legislation, have a significant impact on how we interpret these things into clinical practice. Of course, different questions will arise depending on where an individual is practicing. A clinician who works in a women's clinic does a lot of gynecological care, may have a lot of time spent thinking about what is fetal personhood and abortion, but may spend very little time asking questions around withholding or withdrawing and advanced medical interventions in the way an intensivist would, which may be very different than how a doctor who supports patients in long-term care and conversations around goals of care may not consider either of those in their day-to-day practice. However, a lot of those conversations may have happened in their ethics training around how do we work through uncertainty when we're asking the question, what should we do? Um, a lot of these questions tend to be binary where a decision needs to be made. Should we withdraw life-sustaining treatment? Should we use genetic testing for certain traits? And its primary focus often includes uh, using big E ethics and things like education and policy. It's also given a ton of space for discussion as well, asking ourselves, what do we think? How do we create space for this? It's a lot of times our conversations in grand rounds, in major conference presentations, these issues, because they end up in the media, they are the places that people are having these discussions. Of course, that then gets reflected back into how we discuss this in academic spaces as well. So is the opposite of dramatic big E ethics ordinary little e ethics? I don't think so. And generally, the literature doesn't think so either. It is not a one or the other. Oftentimes, they exist together. So, you may be in a space asking the question is, should we withhold or withdraw a life-sustaining treatment that may no longer be providing any clinical benefit? But there might be lots of little e ethics issues that arise in those moments as well. So, they run together, they don't necessarily run separate from each other. However, we often talk about the big E ethics issues in hopes that it impacts how people engage in the little E ethics issues. However, I think there is an opportunity to have the little E ethics be a core component about how we discuss ethics in clinical practice, in our day-to-day work, so that it may improve our ability to have these conversations when big E ethics issues arise. Now, I've said what is everyday ethics many, many times, but I actually haven't really defined it for you. And there is a reason for that. The current definition is, and I've done a fair amount of reading on this in discussion, to my knowledge, there is no formal definition of everyday clinical ethics that exists. There are lots of people who have defined it in different ways in relation to specifically what they are talking about, whether that be in nursing practice or in specific clinical settings. A lot of times it just goes completely undefined. Oftentimes it's a very much you know it when you see it kind of thing. So ethics is that normatively important and pervasive issues that arise in healthcare. It is the interactions between patients and clinicians, and this interaction that aligns with everyday practice of healthcare. So it's really taking place in a healthcare setting, and it involves two individuals engaging in some form of issue that arises within the provision of healthcare. If it is not defined in that way, or if it's just left open-ended, a lot of times it is also using shared through case examples. Most of what is everyday ethics, and it's shared as what it is not. So it is not these dramatic cases, the ones you read about in the media. It's not a question of what is brain death. It is really looking at questions of what does quality of life mean in long-term care and those kinds of questions. So if we're going to look at creating a definition of what is everyday ethics, it's important to ask, well, what makes a good definition? I'm sure you've had the experience of looking at a definition and being like, well, now I need to go look up a bunch of other terms because this doesn't make sense. Or it is written in a way that is, as we've noted, examples that of what it might be or examples of what it might not be, which doesn't really help you understand what it is specifically. So definitions generally should be precise. They need to be clear and they need to have a positive conception of either what is being measured or how to measure or identify that thing, which is quite difficult when we talk about everyday ethics because it is kind of so broad. Zizobel and Racine, they did a lovely table here in an article about defining everyday ethics. They use the term dramatic ethics as kind of the opposite of that. And they just really created this really nice mirror where the dramatic ethics is that extraordinary, the thing you're likely to not come across on a daily basis, where everyday ethics is really functioning as a question around the ordinary, the day-to-day things, the things you're going to see all of the time that are often go unrecognized as having an ethical component. They are often less salient, they have less media profile, and they are associated with the routine moments in healthcare. We know here it's perceived as lower stakes, where a lot of these extraordinary dramatic ethics issues are perceived as high drama. They bring people in that the stakes feel really, really high. I think it's a good acknowledgement that that is how it is perceived. I think it's really important, though, to reflect that everyday ethics in these day-to-day interactions actually have a huge potential to have lingering ramifications. Those conversations that happen at the bedside, if they go badly, if there is a damage in trust, individuals are likely to remember that long past that interaction, and can impact their willingness to be come forward for healthcare again or to share information with healthcare providers. Um, so just because it is not is perceived as low stake doesn't necessarily mean it is low stakes. And I think that is part of the reason I think we need to talk about everyday ethics because it has this, but it happens every day. It happens so routinely, and it can have such a significant impact that it's a reason we need to keep talking about it. Um, Often for dramatic ethics, it's described or set up as an ethics dilemma where you have that decision that needs to be made. Where often on the other side of that, everyday ethics is presented more as procedural or a practical question. It's not often labeled as an ethics issue. It's a challenging relationship. I don't like the way this program's set up. I don't understand why we have to do it this way. Versus, are there values in play in this conversation that may actually be impacting how it's being experienced, how decisions are being made? Not necessarily that something unethical is happening, but some of that tension may be driven by some of the values tensions that we don't acknowledge or label. Dramatic ethics, as it is generally taught, often focuses on principles, where everyday ethics, because there may not always be a decision to be made, it often engages in other contextual forms of ethics. In particular, I think narrative ethics is a really interesting one as it engages in everyday ethics. It also engages because there's such an important relationship component to it. Things like feminist ethics, care ethics are often a part of that as well. So, what shapes everyday ethics? Often it is remains unseen are those overlooked daily moments that actually do have an ethics consideration. It is viewed as that practical or clinical issue where the ethics issue remains unspoken. Uh, because it is every day, it's often seen as part of just, it has to happen. We can't stop every time I have a clinical interaction with somebody. Um, in an article I was reading recently, it was an excellent comparison, I thought, to the idea of we had to have a deep deliberation every time we had any kind of clinical interaction. The patient says, "Oh, I don't want a vaccine because it is full of, you know, microchips," or some other comment where you're like, "Oh, I would like to ask some maybe follow-up questions or and concerns around mis or disinformation." Um, if we had to take a pause every time that happens, you're gonna potentially impact that relationship with that patient. If you have to pause and really think through this in a deep, um, deliberative way, so you end up going through it really quickly, and you may not recognize that there may have been some values and considerations in that conversation. Um, And so this everyday ethics is an opportunity to acknowledge, maybe not in the moment, but after the fact, some of those values that were guiding that conversation. In this article, as I mentioned, it talked about a violinist who really wanted to focus on every aspect of what they were doing because they really wanted to make sure it was all done right. But by trying to focus on everything with their full attention, they weren't actually able to do anything. They kind of got stuck. If we had to stop and be deliberative every time we have a conversation with a patient or engage in the clinical setting, we would get stuck as well. So everyday ethics is a part of practice. It doesn't mean that every time you have an interaction, you need to speak to a clinical ethicist or there needs to be a big debrief. But it's also an acknowledgement that in those conversations, in those moments, there is an ethics component involved. It involves interaction with people. It is recognizing that we live in a pluralistic society. This agreement can be quite difficult. It is a little bit interesting when you get into the healthcare setting. We generally have a greater level of overlap of goals. We're looking, care or comfort or health, treatment. But that still doesn't necessarily mean we're going to agree on what should be done. Our values may come into conflict, or our understanding of the situation may differ in the ways that we want to approach any given issue. It is also incredibly relational, and it involves a lot of contextual features. So, talking about it being ethics of representation, reciprocity, and reconciliation. So the idea of who do you as a healthcare provider bring to the conversation? How do you represent yourself in your field, in your profession, in the chart, in your interactions at the bedside, at the nursing station, at grand rounds? Also giving patients the opportunity to do the same, to share who they are in this space. Um, the reconciliation piece is asking the question of when it goes wrong, are we able to forgive and move forward in that space? And recognizing that there's a lot of contextual features that go into that. Who somebody is and represents themselves within the healthcare system, how the clinician sees themselves within that role will all impact how they approach an everyday ethics concern. So I'm actually going to move into a clip in a moment. Before I do, I know the chat is open, so I would welcome any thoughts or feedback on kind of what your understanding of everyday ethics is. This clip is about a minute long. I'm going to move over and then pause it briefly to give it a chance to make sure it doesn't get all stuttery. We did test it in advance and the sound should be working. I've done this before with other people where we've watched short medical drama clips, and it's very interesting to see what different individuals will pull out as like, that is the ethics issue. I will note that the clip is from Grey's Anatomy. It's a show I have actually, I think, maybe seen one or two episodes of. So I actually don't know who any of the characters are in this thing. I really just did a quick YouTube search of medical dramas, trying to find a pretty mundane clinical interaction. Um, I think there are potentially some big E ethics issues in this moment, but I think there are also potentially a lot of little E ethics issues based on the information I just shared. But when I watch the video, what I pull out and what another colleague might see and what they pull out might be different. And that doesn't mean that we don't have shared goals when we enter into these spaces, but what we notice and what initially is potentially intention might actually be different. So I'm gonna move over and prep the clip. And I would encourage you to take a moment. What I can do as well is if the clip is only a minute long, so I can play it, give it a pause. If you want me to play it a second time, I'm happy to do so. Is my First gonna give it a second to make sure it loads. Hopefully I haven't lost too many of you. Okay. Hopefully the volume's loud enough. I do have closed captions on as well, if you're having audio issues. Hi, Mom, okay?
Oh, she's stable. We'll know more soon. Let's make sure you have no other injuries.
Snowmobiling was her idea. So it's pushing me to face my fears. She was right. It was a lot of fun. God, why is she always right?
I know how you feel.
I mean, fun until she swerved to miss a tree and flipped us 5 times.
Hey, we should get a CT angio to determine the location of her vascular injuries.
There.
Excuse me?
Their injury, not her. I'm a they.
I'm genderqueer. Non-binary. Got it. Thank you for letting us know your pronouns.
Their preferred pronouns are they and them.
Okay, yes. Well, all right then. Well, let's get you... All?
You. It's fine.
Great. Well, your ultrasound is fine. Let's get you up to CT.
So that is the clip. Would people like me to play it again? Or I would really welcome your input either in the chat. I don't know if people are allowed to come off mute and speak as well. and share their thoughts on what maybe some of the everyday ethics issues. I'm seeing on the chat that people want to see it again because it's a minute long. I'm going to quickly replay it. And then for those that already have thoughts, you're welcome to pop them in the chat. And then we'll have a discussion.
Is my mom okay?
Oh, she's stable. We'll know more soon. Let's make sure you have no other injuries.
Snowmobiling was her idea. So it's pushing me to face my fears. She was right. It was a lot of fun. God, why is she always right?
I know how you feel.
I mean, fun until she swerved to miss a tree and flipped us 5 times.
Hey, we should get a CT angio to determine the location of her vascular injuries.
There.
Excuse me?
Their injury, not her. I'm a they.
I'm genderqueer. Non-binary. Got it. Thank you for letting us know your pronouns.
Their preferred pronouns are they and them.
Oh, okay, yes. Well, all right then. Well, let's get you... all?
You. It's fine.
Great. Well, your ultrasound is fine. Let's get you up to CT.
Okay. I immediately have a couple of things that have popped to mind, but I think the most valuable part of doing something like this is getting other people's perspective on what they immediately were drawn to in what was a pretty, like there was a learning moment for sure there. But like not necessarily a very dramatic moment in a clinical interaction, but there is some potentially ethical issues going on around them, or in the engagement of the conversation as well. Give people a hot minute to chat. Yeah, the gender affirming care piece I think is an important one. I think that's one of those places where there's the little e ethics of this individual patient's expression of their pronouns. And so I think there is an opportunity there for the little e ethics, that relationship piece. But I think that actually might be one of the big e ethics issues. How do we create a safe place for trans, non-binary individuals coming into the healthcare system? How do we document that? How do we communicate that among our colleagues? So considerations around unintentional disclosures for those that are not sharing that information widely, but it may be relevant for their medical information. I see another comment here around not obtaining consent for a medical intervention. I think that was one that I drew upon right away as well. I think it also, when it comes to consent, is a very interesting space for everyday ethics because consent is something we do all of the time. It doesn't feel extraordinary. But there is a lot of potential considerations for how we go about that, what values are guiding that process for different clinicians. I was reading an article that talked about how anesthesiologists might approach sedation and whether they disclose one of the potential side effects as death. Some worrying about, well, I don't want to scare them. The risk is very, very low. And others saying, like, no, in order for them to have true informed consent, I have to tell them everything. And some people are changing based on how the different individual is approaching their informed consent process. Where everyday ethics might have a role in that is asking the question, why did you decide not to disclose or did disclose it? As a way of kind of really unpacking one's own values around what it means to give and get informed consent. I agree in this video, they did not get informed consent for the CT. She appeared to give at least assent to the ultrasound as it was happening. We hope that when they go upstairs to CT, that there is an opportunity for them to provide informed consent. Is there anything else? There's one that I picked up right away. Yeah, and a comment around trying to build rapport with the patient by agreeing with them, um, and trying to recognizing everyday ethics as part of that like relational contextual piece. Um, and I think you're picking on a piece of around narrative ethics as well. I think uh, trying to create that relationship, the patient is sharing something personal, both in relation to what happened to them, but also sharing that they had been very nervous and that their mother had encouraged them to try something new, to be brave, and that relationship has the potential to impact how the clinicians themselves engage with this person who seemed like they might have been a little bit nervous, but also expressed how much fun they'd had in doing that, until they rolled 5 times. Um, Something that I picked up on is, and you may not have noticed it if you were really focused on the dialogue and the immediate relationship, is this person is mostly undressed and receiving all kinds of clinical interventions. However, they are exposed to the entire, what I'm assuming is an emergency room. The curtains are not pulled. There are people walking back and forth in the background. Of course, this is a medical drama, and they may be wanting to show that they're in a busy clinical setting. However, there's some concerns around maybe some privacy questions, some confidentiality questions. They have the medical records open and facing out. So those are all potential everyday ethics questions. In this moment, was there a reason to stop and pause and say, like, how are we getting informed consent? There may have been an opportunity to say, maybe we should pull the curtains to, protect privacy and confidentiality. But it might actually happen after the fact in like a debriefing setting where I say, it was weird that we didn't actually pull the curtain. Is there a reason that we decided not to pull the curtain in this case? Are all opportunities to reflect on how ethics may have been unseen or unspoken, but actually guiding people's decisions. Thank you so much for all your thoughts on some of the everyday ethics issues that might arise in this clip. It is an interesting activity to play to see what different people pick up on. Things that I may not have noticed, and others that's what they picked up on right away. Let's see if I can move past this video. So I really like this quote coming from the literature that was specific. I'm a little worried about saying the last name because I'm going to say it wrong. Omir Skarov wrote one of the, not necessarily original, but it's kind of like one of the foundations for microethics. In 1995, Arthur Kaplan wrote a wonderful chapter in a book in 1990 around everyday ethics, particularly in long-term care, reflecting that we do spend a lot of time talking about these critical care interventions, and a lot of space is given to things like genetics and abortion and advanced life-sustaining measures. But if you go into a long-term care home setting, there are lots of ethics issues that arise around things like freedom of movement. What does, like, when and where you want to eat your meals, go to bed, you know, how do engage in living in a more communal setting? And there are all these ethics issues that we aren't discussing, but are very present in these individuals' lives. So clinical medicine is eminently ethical, and within it is the process of ethical judgment. The process of ethical judgment is continuous. So this is ongoing, whether it is spoken or not, it is occurring. So just kind of wrapping up the definitions piece. In struggling to define everyday ethics, something that comes up quite a bit is everyday ethics, it may significantly vary between individuals. So what is everyday? That may look very different to somebody working in a high acuity acute care setting compared to somebody who works in a family medicine unit whether they work rural or in a big academic center. Their types of training and experience will also impact how they define the everyday. And also runs the risk of being either too narrow and missing a whole lot of, the ethical interactions that happen all the time, or too broad and either capturing the big E ethics issues or being so broad that it is not practical in the teaching moment. It also, the definition may capture these very things through the eyes of the author. What are the author's experiences, values, and biases that may shape their definition of everyday ethics? So kind of raises the question, if we're really struggling to define it, and it's kind of been given that what it often gets defined as what it is not, or you'll know it when you see it. Is there a better way to approach everyday ethics that doesn't require a refined definition? So should we define everyday ethics or maybe explore alternative means of engaging with the concept of everyday ethics without necessarily pinpointing a clear definition, recognizing some of the risks that exist in these spaces? When we open it up for chat, I'd love to hear your thoughts on that. I'm going to leave it at this point, really focusing on the examples of the comparison that was shared on that table earlier about what we might see as everyday ethics. So why is it important that we talk about everyday ethics? I've kind of already hinted at this as I've gone along, but I think a huge piece of this is the development of that moral judgment. In the quote, it mentioned that this is an ongoing process that continues to happen. Oftentimes when we teach ethics courses, how we think through an ethics issue, we are very deliberative about it. We end up in this space of slow thinking, where it's really conscious reflection. It requires a lot of effort, asking many stakeholders what their thoughts are, what values different individuals are bringing to that moment. And it's great for really strengthening values awareness, both of the recognizing the values that others bring to this interaction, but also our own in that moment. Where in everyday ethics, we often end up in a space of intuition, where you end up with that gut feeling of what is the right thing to do. I can't stop and engage in this really reflective moment. These interactions are involuntary or unconscious, and it risks potentially furthering bias or discrimination if we aren't aware of why we're making decisions. But again, we can't necessarily always stop to engage in this deliberative process. So how do we engage in that intuition in a way that is more values grounded? Can we teach moral intuition? There is some varying opinions on that. I think it is important, though, that we have a conversation about how those values might exist in those spaces, even if you don't necessarily think about it that way. And a good example that I read was around a patient coming in for a consultation around an abortion. There is the more deliberative process that we might engage in a academic space or in a more of a learning environment around things like what is our moral obligation to the pregnant person, what is the concept, where does the role of fetal personhood play in here? However, is probably not the conversation you are having at the bedside with this pregnant person. They might be sharing with you their concerns around being able to care for their other children. They may be asking questions around what does this mean for my engagement with my religious or faith group, where you're going to have to respond in a meaningful way to some of these questions, and how you go about that may be helpful to have some of that deliberation before. It may require some debriefing after if maybe we're a bit caught off guard by that question. But it gives an opportunity to have had a recognition that there are values at play in answering that question. I think it also gives an opportunity in talking about everyday ethics for a bit of moral imagination. When we talk about only the big E ethics issues, we often talk about options, it being a bit more binary. What should we do in a specific situation? Where in everyday ethics, a lot of times it is that what it feels like a practical issue or a challenging relationship where we get kind of stuck in the moment, but giving opportunity to say, okay, what are the values that are guiding that person's decision and guiding mine, and how do I move forward, determine of the options in front of me, what is most appropriate. Uh, uh, Individual that I've been talking to in the space of everyday ethics likes to use the example of what would you do if somebody comes to the clinic 25 minutes late for their appointment? Do you see them? Maybe you have a strict policy of after 10 minutes, we can accommodate, it will throw off our meeting everybody else's needs. It would force our clinical staff to stay late, which may or may not be possible. But what if they shared that, they had to take the day off work to come here and they may not be able to do so again? Um, what if they have to go to the emergency department and sit there for several hours because you weren't able to see them? Taking up space in an acute care space, would it feel justified to see them then? What if the bus had broken down and they would have been on time, but for factors completely outside of your control? So recognizing that it feels like a very practical question to say whether or not we should see this person if they're very late to their appointment, but considering those contextual features and asking the question, is it appropriate? Is this a decision that I need support with? Do I need to step away from for a moment? Do I have a strong bias of like, no, being on time is important and respectful, and if you can't do that, you can't come. Or you might have been in a situation of being low income and saying like, oh, I've been there where, missing a day of work, is quite a dramatic experience. I will squeeze them in no matter what. Is it a binary? Yes, we'll see them. No, we won't. Or is there actually other alternative options? If there's a cancellation that day, and if you can be here within the next period of time, we will happy to see you. Are there other people that can see you? Are there other places we can send you that might be able to meet your needs in that way today? So I think it gives an opportunity to reflect on, not when we think about, oh, it's ordinary, it's routine, it just happens all the time. There might be an opportunity for a little reflection of, does it always have to be that way? Is it really black or white? I also think more everyday ethics raises an interesting question around power dynamics. When we talk about big E ethics issues, who's at the table? Who raises these questions? It's often because there is a decision to be made, it's often a primary decision maker who often might be a clinician or a manager or a leader who might have a lot of authority to say, this is an ethics issue and I need help in going through the options and deliberating on what we should do in this situation. However, everyday ethics issues often are not, when they don't have a decision to be made, they may be asked by or conducted by people who may perceive that they don't have the same level of power or feel that they are able to ask for the space to engage in some of these questions. By asking and teaching and engaging in spaces of everyday ethics, it often gives maybe greater space for engaging in these ordinary questions where we say, well, no, we give space to the extraordinary. It's both interesting, and the people who are making those decisions are the ones in a position to create that space. I also think it strengthens moral courage when we give clinicians the language to talk about the values at play in their everyday work, that when these bigger issues arise or if there's ongoing issues in that everyday space, to say, like, maybe we need to spend more time thinking about this. Maybe we need to get creative in these spaces. So why I keep talking about everyday ethics? Obviously, consultation service is not a solution for the everyday moments. So talking about everyday ethics early on and ongoing as a recognition that sometimes things are uncomfortable and there may be a values component in that, but it doesn't necessarily require a consultation or to create a solution, but really an acknowledgement of that space. It's a recognition that small matters can have a large impact. I talked about earlier about that kind of ripple effect of trust, and like damaged trust may impact a person's willingness to share new information. We watched that clip. If physician that was doing the ultrasound had responded really poorly, that an individual may feel less comfortable disclosing their pronouns or seeking healthcare at that site, or coming back to the emergency department if they have issues later on. Talking about everyday ethics helps prepare clinicians for the realities of their daily work. When we only talk about these really impactful, dramatic cases, they may not reflect the kind of values considerations they need to do on a day-to-day basis. And talking about everyday ethics creates an opportunity to explore what is considered worthy of being an ethical dilemma and worthy of creating space and time to discuss. So kind of a little bit of next steps, kind of summary space. I think engaging in everyday ethics is really important early on in the education space for clinicians. Yes, the extraordinary is interesting. It's a great way to draw people in, but I don't think we can stop there. I think it's important to stop and ask about the complexities of the ordinary, the complexities that exist in informed consent, the complexities that exist within trying to maintain privacy and confidentiality, at the same time acknowledging concerns around, are there risks to others or disclosures in those spaces. It also, engaging in everyday ethics creates space for discussion of issues that may not necessarily require a decision. So talking about case examples or issues that are arising that maybe are a policy issue or what might be received as like a clinical issue is asking the question, are there other underlying ethics issues that we would want to acknowledge as driving some of this? Again, exploring opportunities for debriefing cases with an ethics perspective, where we may be talking about something that wasn't super dramatic, but there's an opportunity to unpack some of the values that were underlying an individual's decision making. An example might be in having a conversation with a patient around a treatment plan. It went well, it was a good conversation. After the fact, doing a bit of a debriefing around like, well, why did you say this? They asked for advice and you refuse to engage in that. Is there a reason? And you might say like confidentiality is super important, boundaries is super important. And another clinician, I'd say, like, he shared a bunch of personal information, saying like, well, I really wanted to build trust and a bond with this patient. And it seemed to really bring them out of their shell. And that's why I did it. And I've done that in the past, as an opportunity to really reflect on maybe some of the values that are underlying the reasons you are doing things without really thinking about it. I also think, in addition to the early stages of clinical education and just what types of cases we talk about, I think everyday ethics is a great opportunity to embed ethics in other forms of education, particularly simulation education, where you might be in a moment where we're talking about like starting an IV or, in the middle of a code. Are there ethics issues underlying here that we might bring up as part of that training to acknowledge that ethics is part of this conversation? So, just as we come to the end here, I want to acknowledge that everyday ethics is alive and well. There are lots of people writing about it, but it's also becoming embedded in other kinds of spaces as well. So the American Nursing Association's Code of Ethics for Nurses in 2025 actually included a bunch of language around everyday ethics. So nurses also recognize that patients' interactions have ethical implications and appreciate that these moments are particularly salient times to practice everyday ethics. I will note, though, that they don't actually define what everyday ethics is. So noting that everyday ethics is very much something that is coming up, that people are talking about. So ignoring it won't go away. It is part of practice. So very briefly, just wanted to say that this is ongoing work and discussion in my life, and I would really love your kind of thoughts on whether everyday ethics resonates with you, you think it is something valuable to discuss. I'm conflating things, I'm, focusing too much on one thing or another. And I included a bunch of resources at the end and for you to look at. But I would really appreciate anyone's perspective on what you think of everyday ethics, whether we really should be defining it specifically or whether kind of just acknowledging that it is a thing is good enough. So questions, comments, concerns, I would welcome them all. And so here's my contact information. If you don't want to, or you have additional thoughts after the fact, please feel free to send me an email. I'm happy to continue to engage in this conversation. And lots of references here. There are lots of great articles on everyday ethics.